So, folks, as we said earlier, most people associate seizures with convulsions and loss of consciousness. But not all seizures look like that. Joining us today to discuss non-convulsive seizures is consultant pediatrician and pediatric neurology, Dr. Judy Tapper. Dr. Tapper, good morning. Welcome to Smile. Thanks for speaking with us this morning. How are you?
Yes, good morning. Thanks for having me and giving me this opportunity to speak about epilepsy.
Yeah, man, it is our pleasure. And I hope before we start that your family, you are okay after this terrible hurricane.
Yes, thank you very much. Thanks for asking. Thank you.
Yeah. Let's start there. What is epilepsy?
So epilepsy is a disorder of the brain in which you have recurrent unprovoked seizures. And if you have 2 or more seizures occurring more than 24 hours apart, you fulfill the criteria for epilepsy. A seizure is a abnormal condition in which you have excessive electrical discharges coming from the brain, and it results in a change in how the body functions for a brief period of time. And depending on where in the brain the seizure starts or occurs, you get different symptoms. So generally, we divide seizures into focal seizures and generalized seizures.
Okay, that's what we call fits, right?
Not necessarily. So I'm going to start with the generalized seizures first, because those are divided in 2 types, okay. One with motor symptoms and one without motor symptoms. And I should say generalized seizures involve the entire brain, as opposed to focal seizures, which involves just a half of the brain or a part of the brain. With generalized seizures, you always have total impairment in consciousness. And the ones that we think of or called fits are those that are usually associated with a convulsion, where someone will go unresponsive, fall to the ground, and have jerky movements of the body.
Okay.
Go ahead.
I was saying I suspect, therefore, that the non-convulsive ones are a little bit more technical, because how do you identify them and how are they classified?
So the ones without convulsions, the generalized, are basically the absence seizures. And it's called absence because it's a French term for absent, and you're absent during that period of time. These seizures are very subtle seizures. They're very brief. They occur over a 5 to 10 second period, not longer than 15 seconds. Usually they are very abrupt in how they onset and abrupt in how they start. So during the event, the patient or the person just goes unresponsive for a very brief period. And you may have what we call some subtle automatism, such as you may blink your eyes, or you may swallow repeatedly, or smack your lips. If you're walking, you continue walking, but you don't fall. And you may walk purposelessly and say walk out into traffic. Mm-hmm. The commonest type of absence seizures are those that we call childhood epilepsy absence, or childhood absence epilepsy. And these start in children around the age of about 4 to 7 years, usually by about 10 years of age. And the children have these recurrent episodes where they just blank out for a couple seconds and then they come back. But they occur very frequently. And as you would imagine, if you have a child in a classroom setting, blanking out repeatedly, over time, their school performance falls off because they're not able to follow the trend of what the teacher is teaching, and their grades and their performance decline. So it's a very important type of epilepsy, not just for healthcare professionals to know about, but also for teachers to know about. You may have a child in your classroom who is blanking out frequently. And you can imagine if you have a large classroom with 20, 30 or more children, this might be very difficult to pick up. But in time, the family gets to realize that the child is blanking out. At first, you may think that they're just daydreaming or being inattentive, but these recur so frequently that you get to realize that something is happening. And as I said, over time, if these are not treated, they do result in a decline in the children's performance.
Yep. Dr. Tapper, you may have answered this already, because I heard when you said that you develop it at 4 years old, but are you born with epilepsy, and can it come on at any age? All my life, me can still get epilepsy?
Yes, so epilepsy occurs most frequently in the young children at the extremes of age, in the younger child or in the elderly. And some of these conditions are genetic, or you're born with it. Some of them are acquired. In the elderly, say, you get epilepsy mainly from things like stroke or dementia. In the younger children, these are sometimes genetic abnormalities, congenital abnormalities of the brain, or sometimes some injury to the brain, maybe lack of blood flow to the brain at the time of birth, infections, or sometimes things like infections like meningitis or toxic ingestion of substances.
Yep. Can it be cured?
Epilepsy cannot be cured, but we can treat your epilepsy. So, for example, with the children having absence epilepsy, it's just very so important that these children are brought to medical attention, because once they are brought in, we usually take a detailed history and make an assessment of what is happening. And then, particularly with absence seizures, if you do a simple procedure such as getting the patient to have some deep breathing, hyperventilation for 1 minute to 3 minutes, this usually brings on the seizure and helps to confirm the diagnosis. We then go on to do a test, an electrical test called an EEG, an electroencephalogram, which looks at the brain waves. And that is further confirmation of the patient having epilepsy. It helps in telling us the type of seizures and epilepsy that the patient is having, and this helps with management of the patient. And the first line management is anti-seizure medication. And luckily, with, say, childhood absence epilepsy, this usually responds very well to specific anti-seizure medications. And it's important that you take your medication as prescribed. Most of these medications need to be taken twice daily. A few can be taken once a day, but most twice daily. And it's important to stay on the medication, because that usually controls and stops the seizure. And in the case of childhood absence epilepsy, say, once the seizures are controlled, the children continue in school. These children usually are of normal intelligence, so their academic performance picks up. And particularly with childhood absence epilepsy, this is what we call a self-limiting type of epilepsy. So with time, it goes away. And usually by pubertal years, age 12 to 16, the epilepsy resolves, and the children are able to come off medication, and the seizures do not recur.
Mm-hmm. Along with the medical care, Doc, what are some of the ways that parents, teachers, support givers can help with the management of silent seizures? So
one thing, programs like this helping us to make awareness, then be aware of these seizures. And if you notice a child behaving in an unusual manner, if you notice children's school performance is falling off in association with that, then that would be important to look at that. Also, we may have other type of silent seizures, so to speak, focal seizures, in which you have your consciousness may be preserved. You may be fully conscious and still having a seizure, or you may be totally impaired in your consciousness and have seizures that may have different symptomatologies, such as behavioral changes, behavioral arrest, or emotional changes. You may get angry or excited, elated, or you may get anxious or may get fear. And usually the focal seizures, unlike the absence seizures, happen for a longer period of time. So the absence seizures are very brief, not longer than 15 seconds, usually 5 or 10 seconds, but the focal seizures may go on for 30 seconds up to 2 minutes or more. And usually there's some warning sign. The child or the patient would have a warning for the seizure, and afterwards they may become a little drowsy or confused and may even sleep.
Okay. As we come to the end of the interview, Doc, double-barrel question here, because we had a case that someone had a convulsive seizure around us, and you heard different things. No, do this. And somebody said, no, man, don't do that. And so not everyone knows what to do. So the average Joe I'm talking about here, I'm not talking about medical people, because obviously they know what to do. So what do we do in a situation like that? And the second part of the question is, can you die from a seizure?
Okay, so Let me answer the first part. So in an emergency situation, a patient having a seizure, what we should try and do is usually if they're having a convulsion, they'd have fallen, they're on the ground. We should put them on their side. So, and that way this opens their airway, their tongue falls forward, any saliva in the mouth will come forward and they won't choke on their saliva. We should stay with them. We shouldn't restrain them, but we should make sure they can't harm themselves, put a cushion on their head, take all sharp objects out of their way. And if they have on any tight clothing, loosen that and stay with the patient. Very important. We used to, in the old days, put something in the mouth to hold down the tongue so that they wouldn't bite their tongue and swallow their tongue. There's no need to do that. Once you put the patient on their side, that opens up their airway and make their breathing better. And if you put something in the mouth, you can actually do a lot of harm because the patient has tightening of the muscles of the jaw. Sometimes you can break off teeth trying to open the mouth, and sometimes the patient can bite onto what you are trying to put in the mouth and bite that off and swallow that or aspirate on that. So that's very harmful to do. And the other thing to do is not to crowd the patient, give the patient air to breathe. And once the seizure has stopped, we can then and they've come to, we can then offer them something to drink and make sure they're okay. If a seizure goes on for more than 5 minutes, which is a long seizure, we should take that patient to the hospital.
Okay.
Can you die from it?
If you have prolonged seizures, yes, you can. And if you are having seizures and your seizures are controlled, and you suddenly stop your seizures, your seizure medication, you can have prolonged seizures again. And there's a condition called sudden unexpected death with epilepsy, SUDEP, that can be associated with prolonged seizures or seizures. But usually it's in a situation where patients will suddenly come off of their medication thinking, oh, their epilepsy is doing well. They stop their medication and then they have prolonged seizures.
Yep.
The lesson is to stay on your anti-seizure medication unless otherwise advised by your healthcare professional.
Yep. I said at the top that it's Epilepsy Awareness Month. Anything special happening this month?
Not that I know of.
Okay.
But again, I thank you for having me this morning to bring awareness to this topic.
Very, very well explained, Dr. Tapper. Thank you so much for being with us. God bless you and your family.
You're welcome. Thanks so much for having me. Thank you.
That was Dr. Judy Tapper, consultant, pediatrician and pediatric neurology. That's 10 minutes to your health.
We'll do it again next Thursday. All right, folks, when we come back, Daily will take another book off the shelf to discuss hair matters, like in that here.